Hi, my name's Miss Burns. I will be your child's classroom teacher this year. Today I'm here to talk about special education, and more specifically the legislation that led to the special education that we have today. So let's begin. Legislation for people with disabilities has started being developed in the 1960s, and it started from parents who started organized advocacy groups for their children that became vocal enough to attract attention and result in legislation to provide educational supports to children with disabilities. The first legislation we're going to talk about occurred in 1971, and it was the Pennsylvania Association of Retarded Children, or PARC, and they won a case against the Commonwealth of Pennsylvania, and the decision was based on the 14th Amendment, and it assured that all children, including those with disabilities, the right to a free and appropriate public education, or FAPE. That's our acronym. That's teacher talk, and we love acronyms. So if you hear FAPE, you know what we're talking about. Another piece of legislation occurred in 1973 is Section 504 of the Vocational Rehabilitation Act of 1973, and this applied at first to employment and said that no one could be discriminated against based on their disability, and they couldn't be excluded from participation benefits or discrimination under any program that received federal financial assistance. And to strengthen that, in 1974 came the Rehabilitation Act Amendments of 1974, and this extended the coverage to all civil rights, including education, employment, health, welfare, and other social service programs. Under the Section 504, all recipients of the Department of Education funds that operate public elementary and secondary schools must provide a free and appropriate public education, or a FAPE, to each qualified individual with a disability in their jurisdiction regardless of severity of disabilities. So what this means, for students with disabilities who qualify under Section 504, this means that the school must make special arrangements so that the students are able to have access to a full range of programs and activities offered if needed. This is all determined by a multidisciplinary team, and they determine the student's special need or service needs. And then this Rehabilitation Act of 1973 was also made stronger by the Americans with Disability Act of 1990, and this act specifically defines discrimination, both intentional and unintentional, as segregation, inferior or less effective services, benefits or activities, architectural, so be no building with stairs in only, transportation and communication barriers, failure to make reasonable accommodations, and discriminatory qualification and performance standards. So basically what this means is that new buildings must meet minimum requirements for accessibility for individuals with disabilities. That means that they need to have a wheelchair ramp going into their building, and that they need to also have handicap accessible bathrooms. And then the big one came in 1975, and this is called the Education for All Handicapped Children's Act of 1975. It was later changed to IDEA, or the Individuals with Disabilities Education Act. And this is the most far-reaching and revolutionary legislation related to education. This says that all children between the ages of 3 and 8 must be provided with free and appropriate public education. An education program must be designed to meet the child's needs in their least restrictive environment. What this means is that the child will be placed in a classroom that will benefit the child the most. Could be a regular classroom, could be a special education classroom, or it could be another placement. The there was some amendments to this act. The first one came in 1986, and this established a statewide comprehensive, coordinated, multidisciplinary interagency program for early intervention services for infants and toddlers with handicaps and their families. And some more came later on. An IEP, or an individualized education plan for children determined to have disability, have to have one of those. And all children ages 3 to 21 with disabilities receiving any type of special education services must have an individualized education program prepared especially for them. At the bottom, this is all on my website, so if you want to read it, you can go back and look at it. It's all in there. And I also have included a website to explain some more of special education laws if you have any other questions. And as always, don't be afraid to ask. We're here to help you understand what's going on.